Hello everyone, my name is Dr. Prakash. I'm a consultant orthopedic and joint replacement surgeon at Renova Hospitals, Kompally. Today we are here to discuss about total hip replacement, especially in patients post-COVID. We know COVID has been a dreadful disease in the last 2 to 3 years. It has taken many a toll and many lives of our near and dear ones. But the COVID hasn't ended yet completely. The complications which has come out of COVID have been having long-lasting effects almost on all the organs of the body, and bones are no exception. The most common complication we are seeing post-COVID, especially in young patients, is arthritis of hip joint, mainly hip joint. So what happens in arthritis of hip? The femoral head, which is a round and smooth structure which stays in the cup of the acetabulum, gets flattened, becomes arthritic, and patient starts having pain. Usually this happens in elderly people. This can even happen in young people, and we call it as avascular necrosis of femoral head. There are no proper reasons why it is caused, but now post-COVID, especially because on patients whom steroids have been given for longer duration or in higher doses, we are seeing this complication wherein the femoral head is completely getting deformed and people are started having pain in their hip. So what is the solution for them? Initially, we will try few injections like zoledronic acid and also keep them on some tablets. But if the pain is not getting relieved with those things, we might do a procedure called a core decompression, wherein we try to relieve the pressure in the femoral head and try to get it back to its normal shape and contour. Eventually, when the pain becomes more and when there is a difficulty in their activities of daily living, like they are not able to sit cross-legged or do a squatting procedure, then we might have to do a total hip replacement. I know it is very difficult and sounds little difficult in patients, in young patients to get a total hip replacement, but unfortunately with COVID and post-COVID complications, that has to be the ultimate procedure in these patients when their hip arthritis is very high and the pain is very severe. So what do we do in total hip replacement? We change the wall completely of the femoral head and also the cup of the acetabulum, wherein we will create a smooth surface in which the pain will be completely relieved. So the cup and the femoral stem both are changed in it, and the patient will be having a completely pain-free life. In these total hip replacement, we can do both cemented and uncemented total hip replacements. Usually in young patients, we prefer doing an uncemented total hip replacement because any hip replacement usually lasts for around 15 to 20 years if done appropriately. Post that, they might need a revision, and in doing a revision in a cemented total hip replacement will be very difficult. So we usually try to do an uncemented total hip replacement in young patients. So that they will have a pain-free life. So after doing the total hip replacement, we have to take some necessary precautions in order to have a long-lasting total hip replacement surgery. What are they? Initially, we don't allow them to do squatting or cross-leg sitting. We advise them to sit on appropriately a little higher stools. And also, they have to do regular physiotherapy in which they will do the strengthening of the quadriceps, hamstrings, and also their abductors to have a long-lasting total hip replacement for at least 12 to 15 years. In case if they fail, we might have to end up doing a revision in which, again, we always try to prefer to do an uncemented one if the patient is at a young age. If the patient is of an older age, say for example, if more than 65 or 70, if the bone stock is not good enough, and if we don't get an appropriate hold of the cup or the stem, then we prefer to do a cemented total hip arthroplasty in which we use a bone cement to fix both the femoral stem and also the acetabular cup, so that it will have again a good pain-free hips for even in patients with older patients. So they have to be little careful while sleeping, wherein they have to sleep supine mostly and try to keep their legs wide apart so that the ball doesn't get dislocated. So these are some of the few measures that we have to help patients understand and teach them how to maintain it so that they can have a long-lasting total hip arthroplasty, whether it is a cemented one or an uncemented one. Thank you.